Hi, everyone. Welcome back to the Faster Way podcast. I am so thrilled to be here today with my friend, Dr. Meghan Walker. Meghan, thank you so much for being with us.
Oh, I'm so delighted to be here. Thanks, Amanda.
Well, I love any excuse to get you on a call, but unfortunately, I am not super happy with the media just in general in my life. I mean, the past 2 weeks, I go to sleep, I wake up to messages in my inbox, screenshots from the Wall Street Journal, screenshots from Bloomberg Business, screenshots from fill in the blank with ridiculous clickbait headlines. Just last week, I had to clear up some major, massive confusion regarding intermittent fasting. I brought a doctor into my studio because I'm doing air quotes, study came out saying that intermittent fasting caused 91% greater risk of death from cardiovascular disease. I mean, it was just absolutely nonsense. And we're not here to talk about that. And then, no sooner do I deal with that and send out a press release and calm everybody in my community. And then I have other issues coming up in my DMs. So female clients of mine, and I've had 405,000 clients, most of whom are female, are messaging me because they say, hey, Amanda, the Washington Post recently published an article that says, title, Women Are Getting Off Birth Control Amid Misinformation Explosion. And I have people saying, what are your thoughts? I've been on birth control for 23 years because of endometriosis. Other people say, I haven't been on birth control for the past decade because of how it impacted me. But I saw you posted about this on your own profile. And we have been, colleagues for many, many years now. And you happen to have this background in naturopathic and functional medicine. So can we dive into this, Meghan? Is it as exhausting for you as it is for me, this topic?
Yeah, you know what? Yes, it is exhausting. And I think that it's just symptomatic of a larger issue, which is, and probably not with your audience, but with the world in general. We are functionally illiterate when it comes to health. And because we are functionally illiterate when it comes to health and actually how we think about science and critically evaluate science, we as a population are just highly susceptible to the utilization of the media for different entities to get their message out there and create mass confusion.
Right.
And so, if we stay at this just really high level, you and I are consistently frustrated by what's happening. And our audiences are consistently triggered by what's happening because collectively as a society, we are so illiterate when it comes to health and how we critically think about air quotes, science, that the media can do this. And they're going to be able to continue to do this. And you and I are going to continue to be frustrated and have these conversations until we actually start to address this underlying health and science literacy piece.
Oh my gosh. And we should simply go there. My community is professional. My community is passionate. My community happens to be a little bit more in tune with actual science, but yet still, I receive messages from some of my older clients and, they're fearful about the fasting study and they're wondering about this. And the fact that the title on this particular article, Washington Post, Women Are Getting Off Birth Control Amid Misinformation Explosion. Yet what we are talking about is actually the confusion that media outlets create and cause for well-meaning individuals, including many of our clients. So let's just talk about the root cause of this illiteracy when it comes to medical information. Let's just go there first, and then we're going to talk about birth control.
Yeah, for sure. So, I think that when it comes to understanding the science piece and the health piece, I think it's really important to understand where we came from. So we came from, and I'm looking at you drink from a water bottle thinking you were just drinking a massive glass of milk. But it's kind of relevant because that's where we came from, right? We came from an education system that was drink your milk and eat your meats and have your grains and you go to your doctor. And when you go to your doctor will always give you help. And by give you help, meaning we'll give you a pill, we'll give you some kind of tool that will make the problem go away. And for literally the last 100 years, that has been our relationship between government speaking about health and how we are supposed to leverage and utilize a medical and healthcare system. And our education with respect to health came from either our parents or from school, but mostly from school. And we sort of ticked along in that environment. And I think it's really important that we kind of super high level, but that's the environment where we emerged from. And then
Yeah.
slowly what we've seen over the last 15 years is this increased democratization of health information. And as we've started to democratize access to health information, what has not necessarily caught up are government policies and education policies with respect to the information that we are handing to kids. It's vastly out of date. It is ill-informed. It's one size fits all. It is attempting to manage all of the diverging socioeconomic cofactors that are coming into informing health. So it is addressing, it's like as high level as we can possibly be. We have a healthcare system in North America and in Western countries that is so overloaded and overburdened in the management of chronic disease that it literally does not have time to stop and think, let alone speak to lifestyle management of anything, which means our education system for these physicians is not going to cater to, let's train a whole generation of physicians that can speak to lifestyle management or even have time to spend energy looking at the evidence for lifestyle management. The only thing we actually have time to teach them is pharmacological interventions to manage this onslaught of conditions. And so what happens is everyone is in their vertical of respective bias. The government is trying to manage things from a super high level and has no bandwidth, capacity, or knowledge to get down to the individual. The medical schools are teaching and training physicians to manage. It's like the conveyor belt with the chocolates, right? Like we can't keep up. Our only tool of efficiency here is pharmacological. And then we've got this whole audience of people who are like, wait a second. I've had an experience as an individual interacting with these two broader systems. And my experience is completely incongruent with the narrative that I'm getting over there. And so we find ourselves in 2024 where our systems of care do not acknowledge, and I would argue can't acknowledge, the individual experience. And what happens is we have, in this case, a whole cohort and generation of women who are like, wait a second, I keep talking about I talk about my feelings, I talk about my emotions, I talk about my experiences, I talk about my symptoms, and I feel like it's falling on deaf ears. So I actually don't think a huge, maybe I'm an eternal optimist. I don't think most physicians are attempting to gaslight their patients. I don't actually think that's what's happening. I just think they were never trained, or do they have time to sit and look at some of these other lifestyle factors? When we talk to functional medicine physicians who worked in a primary care setting and then now have the time and bandwidth and the model of care to spend time with their patients, their minds are just as blown. They're like, I wish I knew this before. I wish there was a mechanism for me to have more time with patients. When I'm seeing 80 people in a day, the only thing I have time to distribute is the birth control pill to manage everything. And so we have this really strong mismanagement of our mismatch of our care models with what women are actually looking for and needing. And everyone is dissatisfied in the process.
Yeah. I could not have said that better. That was a wonderful summary. And I like your perspective, which is the optimism coming out of you that doctors actually do want to help and they're not purposely gaslighting. I am going to be doing a podcast on medical gaslighting here in the near future with a doctor who's a good friend of mine, because that absolutely does happen. That is absolutely a real thing. But for this conversation, let's assume that medical gaslighting is not on purpose and it's not something that's taking place, because we'll kind of give the doctors, the OBGYNs in particular, the benefit of the doubt. And you're absolutely right. You know, the healthcare, the sick care system, it's not optimized. The government is giving particular blanket recommendations that are so outdated and ill-informed. And, you know, it's funny when you mentioned about looked like I was having a big glass of milk. 25 years ago, I was. I was
Yeah.
sitting at my kitchen table and my mother was saying, you cannot leave the table until you drink the milk. I can still taste it. I can still taste it. And guess what? I was consistently sick. I was consistently bloated. I had, this is, indirectly related, high blood pressure in high school. I'm on blood pressure medication. And I'm sitting there, until college, and I'm drinking a glass of milk, a big, tall glass of milk, because that's what my mom thought was best. And that's what we do. We do what we think is best. But now, women especially, and particularly in my community, in your community, we are questioning and we are second guessing because we are more informed, but yet, and let's dive in, the Washington Post, women are getting off birth control amid misinformation explosion. So the Washington Post is claiming that women are getting off of the pill because of misinformation, where in fact, what I would say is I got off of birth control because I was informed. And now the media is trying to make me feel like that's a mistake because I'm the one that's like, it's unbelievable. So let's talk about birth control, because again, I'm getting all kinds of messages, and some women in my community saying, I've been on birth control for 25 years. I've been on birth control for 30 years. Others are saying, oh my gosh, Amanda, please address this. What do you think about this? I'm triggered. I'm offended because I've never felt better now that I'm off of birth control. So let's just go there. What are your opinions on birth control in general? Let's just dive in.
Yeah. So if we're going to go there, I want to make sure that we are having a nuanced conversation. And this is health literacy 101.
Yeah.
So what we tend to do is we're like, I had an experience, therefore everyone probably has had this experience, or I didn't have this experience, therefore those people are out of touch. And so if we're going to have a conversation around birth control, we have to separate a few things. So one, I think that the birth control pill was an incredible tool as it pertains to the liberation and the agency that women can have over their bodies and their reproductive health. I think this was a massive societal achievement for us to hand that power to women and for women to be able to continue to have autonomous decision-making over what happens with respect to their bodies. I think that is a hallmark and achievement of our respective democracies. That sits in a box over here. Mm-hmm. When we know better, we can do better. And when I say know better, I don't mean, oh, now we know the pill is bad and we should do something better. The whole idea of knowing better, especially as it pertains to birth control, means we actually get curious when women say, I don't feel well when I'm on this. And back to this idea of physicians aren't intentionally gaslighting. They may not be, but they're also not intentionally leaning into being curious about the symptoms that women have been talking about for a long period of time. So continuing this narrative of, oh, you know what, you're fine. There's only 5 known side effects and they're super rare and they probably don't apply to you. We're also past that point. So notwithstanding this huge societal achievement in giving women this autonomous control over their body, we can simultaneously have issues with that intervention when we start to get down to an individual level. And that's really what we're talking about here. And that's what women have been speaking out about. We know that there are correlations and increased risks related to anxiety and depression, in particular for women under the age of 20 who are put on the pill and have that propensity. It can make it worse. We should just acknowledge that individual and that cohort of individuals within the population. We shouldn't be saying, it's really rare, it's probably not you. We should say, yeah, that's a really distinct possibility. I want you to walk into this decision informed. I think we need to break out and be nuanced when we're looking at the literature related to the birth control pill, because there is the use of the birth control pill as a tool to manage your own reproductive health. And then there is the use of the birth control pill as a panacea to treat every hormone-based condition that women are managing. And that is a whole other box that needs to be unpacked. So if your risk factors are low, and if you understand that there are side effects to the pill, and if you understand that it is not necessarily a tool that is the most efficacious at treating hormonally based conditions, and you want to use it as a form of birth control, I'm really happy if that works for you. And I'm really happy that you can make that decision. And I'd be extra happy if you had a medical practitioner who facilitated open dialogue and said, if this isn't working for you, I want you to come back and be really honest with me. I'm open to hearing it, and I want to make sure that we find a solution that works for you. Where I have issue is in this whole other category of women who have other things going on with respect to their health. And the birth control pill is presented to them as the solution that's going to solve all of their problems. And when I wrote on my Instagram about this article and one of my frustrations with it, I shared my own personal experience related to this. And so I had, as so many women do, extremely debilitating periods when I was younger. This was my gateway into naturopathic medicine. And when I went to a physician about this, they're like, don't worry, here's how we're going to treat it. We're going to just put you on the pill. And I was 15 years old and I was not sexually active, but that was the common course of treatment. There was no investigation. There was no, here's what all the differentials could be. We're going to put you on the pill. And what's going to happen is it's going to manage your symptoms. And here's Health Literacy 101. And here's the question to ask any practitioner, whether they are someone you find on TikTok or they're your primary care provider, is this intervention meant to manage symptoms? Or will this intervention actually be ameliorating and improving the condition at hand? That's totally within your right to ask that. And it should be the first question you're looking at. Are we actually fixing the problem, or are we just masking the symptom?
Yeah.
And for many, many women, what happens is they're handed the birth control pill as a tool to manage the pain. And no one is looking deeper to understand what the source of that pain is. So we live in an era where we're seeing epidemic explosions of endometriosis, of PCOS, of hormonal disruption, metabolic disruption. And so putting women on the birth control pill so they are no longer feeling symptomatic when we have these insidious diseases continuing to proliferate in their bodies behind the scenes is deeply problematic. And so one of my main issues with the Washington Post article is we've dismissed all conversations related to women advocating for their health. And I think, regardless of where people stand, I think what we all want is better health care for women. But that's going to have to start with us saying, I believe you. That has to start with us as practitioners saying and leaning in, let me get a little bit more curious about your symptoms. Tell me more about this experience that you are having. Let me step out of the box in which I was trained and be open to the possibility that maybe we can manage your symptoms through lifestyle. And that was my own experience, is that I was put on the pill, and then I was put on the pill continuously. So now you don't get a period at all. And then they changed the pill. And then they're like, well, let's inject you with Depo-Provera, which isn't even on the market anymore because of osteoporosis and cancer risks. And I was 16 years old. And then they said to me, and this is where we just crossed an emotional line. They said, Meghan, we're going to put you on a drug called Lupron. And Lupron will definitely improve your symptoms. I was like, okay. But just as so you know, here's the informed consent. The first time I got it, it will induce essentially menopause. And I was 17 years old. And I remember sitting in that physician's office and saying, no, I do not consent to this. There has got to be a better way for me to get in touch with my health. There's just no way that you need to induce menopause in a 17-year-old kid. Like, what the heck else can I do? Can I change what I'm eating? Can I da-da-da? No, there's no correlation, Meghan, between your food or your exercise or your stress and the symptoms you experience. There's no evidence for that. And it wasn't that there was no evidence. It's that they hadn't read that evidence. And this is where we need to be able to broaden that conversation. So long story short, I left and this is what we do, right? We get curious. This is pre-internet days. We talk to people. I'm having this experience. My mom was talking to people. I got the name of a naturopathic doctor and I walked into his office and he asked me one question and I don't remember anything else that happened. But he said, talk to me about how your body has always and historically responded to stress. And that question was so intelligent to me because it allowed somebody to look at my health in a more complete manner, but it opened the door to understanding all the different parameters and factors that came into being. And I went off the birth control pill. I stopped having any type of medical intervention at that point. And what I did do is I changed my diet. And the number one thing, ironically, to come back full circle to our conversation before, is I removed milk from my diet. Now, did that cure my symptoms? It did. It removed my symptoms. Will that cure everybody's symptoms? No, it won't, because health is more nuanced. My N of one experience does not mean that everyone needs to stop drinking milk to fix their endometriosis or their painful periods. But what it speaks to is, one, the importance of self-advocacy, and two, the power of lifestyle in driving disease. And lifestyle drives disease because we all have a unique genetic template. The one thing that is becoming more and more obvious when we have all these contradictory studies is that health is more nuanced than here's the one way to address the entire population's health. And so until we have practitioners and influencers and individuals on both sides who are willing to acknowledge the value of both ways of looking at the problem, we're going to continue to have this sort of combative misinformation conversation that really derails progress on both sides.
Absolutely phenomenal. Two different points that I want to kind of drill into the nuance around this conversation and so many women's health topics. I've spoken recently with an expert regarding breast implant illness. And I shared with my community that, listen, I have breast implants and I have for many, many years. And personally, my personal experience is that I have not noticed any particular symptoms. Okay. My energy is sky high. I have, 5 babies. I have been able to optimize my metabolism with faster way to fat loss. Conversely, I have experienced negative symptoms with particular birth controls. And our stories are similar, Dr. Walker. When I was in my teenage years, when I was in high school, I had extremely heavy prolonged periods. And I was put on birth control. Same type of thing, continuous birth control. Never do the sugar pills, continue on with the 28-day, I believe I did a low-dose progesterone mini pill at the time. And was also on the Depo-Provera shots at one point, and was then put on a low-dose estrogen pill, then transitioned to the IUD, I believe, is I'm trying to think, Mirena. Is that correct? IUD, is that what it's called?
Yep.
And I was dragging my feet on the Mirena, I remember, because I was like, man, inserting something in my body, it seems, kind of invasive. And I was told over and over and over again by my OBGYN, there are no symptoms. You're going to be fine. People love it, blah, blah, blah. Had
Localized.
The hormones are had the Mirena within months, was experiencing anxiety and depression and fogginess. And I am top of my game, living healthy, doing, and I remember asking actually a friend of mine who happens to be a midwife, I'm like, take this sucker out. Well, it was like after soccer practice one day, I'm like, just take it out. I'm like, well, yeah, it was. And within 3 days, I felt like a fog had lifted within 3 days. And I know it sounds crazy. I felt so much better. And I shared that experience on social media. But I agree, Megan, there's so much nuance around this conversation and many women's health topics. But the willingness of your doctor to be able to say, hey, tell me a little bit about how you're feeling, and being receptive to that. There were so many times in my high school and college years and even my 20s where I wasn't heard, seen, and understood. I was simply told, no, that's not possible. This is fine. Da, da, da. And that for me was a big area of frustration and discouragement, because again, it's your doctor just telling you it's all in your head. It's all in your head. Can't be the Mirena, can't be the birth control, can't be da, da, da. Now I'm not on birth control, and I'm so much happier. But again, You got the Washington Post. Women are getting off birth control amid misinformation explosion. It's just, ugh.
I think we too need to just talk about the fact that there are imperfect solutions to health.
Mm-hmm.
And, when we read the article, there's a huge concern by physicians who have a different bias, but are managing a different challenge within the healthcare system, which is patients seeking abortion because they went off the birth control. This is what they're saying: went off the birth control pill because they were scared to be on any type of oral contraceptive or IUD because of the information that they were hearing. They wound up pregnant and then were in a really challenging situation because that was also not what they wanted.
Yeah.
And, there is no perfect solution here. And this is where having a compassionate practitioner who's like, let's talk about all the things, because you may feel more anxious and you may feel more depressed. And you also may be a 17-year-old in high school with this really bright future. And let's talk about all of the risks that are sitting on the table, and what can we tolerate? I mean,
Yeah.
I have 3 girls, and the thought of them moving through high school and them potentially being pregnant, like that's a really real fear. So we can have these theoretical conversations around, gosh, I felt really awful on the birth control pill and I felt horrible on the birth control pill. But we also have to put all the things on the table. And I think that's just true to life. And I think sometimes we're looking to the medical system to have a perfect solution for us, and we're really angry when they don't. This is an imperfect situation. And for a lot of people, the pill is a good choice for them. The cost benefit analysis is such that they're like, I'm willing to take that. I'm willing to manage those symptoms. That's what works for my life right now. And I'm happy that they have access to that choice. But it's just not necessarily a perfect solution for everybody. And I think that's one of the things a lot of people are just looking for is acknowledgement of this isn't a perfect solution for me. A huge part of this is women just want someone to say, I believe you.
Yeah.
We just want someone to say that. And for the longest time, the research and the medical narrative, like all the research was done on men. And so all these women were like, this doesn't work for me. And they're like, but the research says it's fine for men, right? So there's just so much evidence around how women are treated differently in the healthcare system. So to come like right back up to 30,000 feet, like one of the first things we have to do when it comes to women's health and evidence-informed conversations is, I think as practitioners in particular, we need to sit there and lean in and get curious when women tell us how they feel. And we need to start with, I believe you, not the evidence suggests that your feelings and your symptoms aren't real.
100%. In our final few minutes, let's talk about the fact that you have 3 daughters. I have 3 daughters as well. Now they are 12, 6, and 3. Yours might be just a little bit older than mine, but as a
12, 8,
mom,
and 10.
as 12, 8, and 10, so similar. As a mom, what are your opinions? I mean, that's, I think, just final few minutes. You are a professional, but you're also a mom. So let's go there.
Yeah. And, I just want to acknowledge that question as being so powerful, because where I finally had a real conversation with the gynecologist I was seeing when I was in high school is I looked at him, I said, if I was your daughter, what would you do? And he was completely taken back by the question, because it changes everything. It's like suddenly it's not personal, and it's not what does the research say. I think that even now, as we're entering this sort of preteen phase, one, I'm realizing how difficult it is to actually have these conversations with your own kids and how non-receptive they are, and the different personalities that are existing. So the conversation that I want to have with my 12-year-old, she's not interested in, but my 10-year-old's like deeply curious around these pieces. But one of the things that we're really transparent about are what are our health values. And when we talk about our health values, one of the things that's really important to us is, one, that their symptoms and how they're feeling are acknowledged. We talk about the fact that there are tricky, difficult conversations and situations we're going to be in. I have 3 girls and only 3 girls, and we have a lot of conversations around feminism and empowerment. And when those conversations come up and we talk about hallmarks of feminism and we talk about, the birth control pill, that is a gateway to be able to have broader conversations. So I want my girls to feel equipped and empowered with respect to their own sexual health, with respect to their own reproductive health. I want them to believe when they see a physician. That is a minimum standard that I want to have in place. But I'm really mindful that I want them to be able to make informed decisions around what is going to work best for them and their bodies. I want them to clearly understand the consequences of their actions, whether that is sex or alcohol or cheating on a math test. Like us really understanding that there are consequences you're going to have to own, that will always be there to support you, and that the systems that surround you aren't always perfect, I think is a really important piece for us to acknowledge as well. So this is like a day by day parenting situation in our house, but we lead with these like common values. And I have to say, like, I take advantage of any window I get. So if my 12-year-old gives me a window because a conversation came up at school, like, I use that to just like lay down a little bit more knowledge or information. But like, will I or will I not put my teenagers on the birth control pill? To be honest, yet to be determined. And I suspect where we land is that this is going to be an individual decision for each kid. And what I'm just trying to cultivate right now is an environment where I'm a safe space and a safe place for them to have those conversations, and that they know that regardless of how they feel, that their opinion and their voice matters.
Yeah. And I love the piece regarding the health values. When your values are clear, your decisions become easier. And that's such an important component. That's something I haven't really addressed with Emma, specifically my oldest. And I'm gonna bring that up today, the health values. And so I think for every mom listening, moms of girls in particular, that's a great conversation to have. And I agree. You have to, you got to find the window. You got to have it at the right time. It's, I love my oldest. She's your typical first child, but it can be hard, especially with the oldest, to know kind of when and where and how and why to approach these subjects. So thank you, Meghan. You are truly wonderful. We appreciate how you advocate for women. We appreciate the information that you put out in the world as well to add value. Tell us where we can find you and follow you on social media.
Yeah, the best place to find me is on Instagram, and my handle is at Dr. Meghan Walker.
At Dr. Meghan Walker. You are the best. We are better off since we've had this conversation, and we appreciate your time. Thank you so much.
Thanks, Amanda.
Bye, everyone.